Hello, my name is Angela Kern, and today I would like to share with you my presentation regarding the Affordable Care Act and Title IV Health Promotion and Disease Prevention Initiatives. The American people have been amidst great changes in healthcare reform in recent years. The passage of the Patient Protection and Affordable Care Act by President Barack Obama in 2010 has marked a new era for Americans and their access to healthcare. Along with changes to insurance coverage, the Affordable Care Act has a strong focus on disease prevention and health promotion. Title IV of the Affordable Care Act, titled Prevention of Chronic Disease and Improving Public Health, addresses the need for a shift in focus from treating illness to promoting healthy lifestyle. Throughout this policy, focal points include financial support for public health, education, and insurance coverage expansion to include preventative services. To help the policy of health promotion and disease prevention succeed, financial support is provided through the Prevention and Public Health Fund. The purpose of this federal funding is to provide support to communities as they begin to create health initiatives to reduce disparities such as access to care. This fund enables grant programs for school-based health centers, incentives for prevention of chronic disease and Medicaid, community transformation, health aging and living well, and maternal, infant, and early childhood programs. Through these newly funded programs, health disparities will improve, thus contributing to the goal of this policy to promote health and prevent disease. From this policy within the Affordable Care Act, the National Prevention, Health Promotion, and Public Health Council was formed to aid in coordination of programs aimed at improving healthy lifestyles. This council's main priority is to be the driving force behind prevention, wellness, and health promotion throughout not only the government but also the nation. To do this, the main roles of the Council are to develop the National Prevention, Health Promotion, Public Health, and Integrative Health Care Strategy, as well as communicate with the President and Congress on matters of health issues throughout the United States and recommend changes to current policies in order to achieve the health goals of the national wellness and health promotion. Advantages to the policy of health promotion and disease prevention are quite clear: a healthier state of well-being. It is vital that as the longevity of the current population continues to rise, that the greatest focus of care provided is that of promoting a healthy lifestyle. It is proven that encouraging healthy habits will decrease mortality and morbidity rates. Along with reducing comorbidities and mortality, health promotion will also increase productivity for employers. Through an increased focus of wellness programs derived from insurance company incentives as well as workplace incentives, a direct relationship has been found between wellness programs and financial savings as well as productivity increases. Within the overview of this policy, new grant programs were addressed in which the federal government has allocated funds to help reduce the financial burdens of health promotion. Although federal funding is currently available for this policy, two concerns are present. First off, it is not a large enough amount to fund the appropriate changes which are needed to improve the health system. Secondly, is that this funding has already become a focal point within the budget-cutting crisis currently within Congress. Even with the financial support currently available for health promotion, conflict associated with federal aid is that funding will be reduced after the 2019 fiscal year. By reducing this funding to only $2 million per year, communities that have had the opportunity to build health centers and promote health throughout their communities may no longer have the resources to sustain such establishments or practices. As this policy promotes health and wellness, it will lead to greater access for opportunity for communities to come together to improve their overall well-being as well as reduce healthcare costs. Each year, the United States currently spends trillions of dollars on healthcare services, but the prevalence of chronic disease continues to rise, indicating that further evaluation needs to be performed and action taken to help reduce chronic illnesses. By researching the cause and effects of chronic diseases and healthcare costs, it will be easier to come to resolutions on how health promotion will reduce healthcare costs. As healthcare reform continues in the years to come, a greater connection will be made between promoting wellness and prevention of chronic illness. By improving the state of health throughout communities nationwide, preventable diseases and consequential deaths will continue to decrease over time. Throughout society today, comorbidities and chronic illnesses are more prevalent than ever. It is important that greater focus be placed on health promotion and disease prevention.